Tourniquet device which is applied proximally to the site of the surgery to have bloodless field. Types: non-pneumatic can be applied on rigids. Pneumatic has automatic timer, audiovisual alarm for abnormal pressure, air leak and time. Inflation: some of the characteristics are important to remember. Inflation pressure. Factor taken account is age, skin condition, circumference of the limb, and comorbidities. Calf width at least equal to the diameter of the limb. Wider diameters need lower pressure. Cuff length 3 to 6 inches of overlap. Cuff pressure: upper limb 50 to 75 above systolic, lower limb 100 to 150 above systolic. Limb occlusion pressure: minimum pressure required to occlude arterial blood flow distal to the cuff, depending on systolic blood pressure. Tourniquet time: the absolute time of tourniquet has never been firmly established. 2 hours is most widely accepted. Accentuation: it is done by either external compression using Rhys-Davies accentuator or Ishmark bandage. Elevation for 1 minute is also acceptable. Not indicated infection and malignancy. Padding: 2 to 3 layers of soft tissue padding is necessary. Contraindications: in infected cases, peripheral vascular diseases, malignancies, sickle cell disease, poor skin condition, crush injury. Relative contraindication: while doing arm and nail to decrease the thermal injury and open fractures. Complications: they can be local or systemic complications. Local complications this increases with increased time, that is more than 2 hours. Post-tourniquet paralysis, bone and muscle necrosis, direct vascular injury, post-op swelling and stiffness, wound hematoma, reperfusion injury, post-tourniquet syndrome characterized by edema, stiffness, pallor, weakness, numbness, and pain. Systemic: cardiovascular decompensation, increased CVP, altered acid-base balance.